Good evening, everybody. Welcome to today's topic, that is radial tunnel syndrome, posterior interosseous nerve compression. So we will dive into the topic. Learning objectives: understand anatomy, symptoms, diagnosis, and management. This is a radial tunnel region. Posterior interosseous nerve compression is seen here. Radial tunnel region located on the outer aspect of the upper forearm, about 4 to 5 centimeter distal to the lateral epicondyle in the supinator muscle region. So this is the lateral epicondyle radial nerve, radial tunnel. Yes. Radial nerve anatomy, course of the radial nerve and posterior interosseous nerve. You can see there is an origin is at the C5, C6, C7, C8, and T1. You can see this. The arm course is from the arm radial spinal to forearm. Yes, and branches and distribution. There is superficial branch. You can see the green color part, which indicates the superficial branch sensory area. And here is the motor innervation, deep branch, which extends into extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis. This is the posterior forearm lateral part. This is the dorsum of the hand and the proximal lateral 3.5 fingers. Forearm skeleton. You can see the radius, ulna, and proximal forearm landmarks. This is the humerus, radius, ulna, carpus, metacarpus, phalanges, and lateral side. You can see this also. This is the posterior view. So all these three views you can see. Radial tunnel anatomy. Arcade of Froude, supinator muscle, and radial tunnel. So this is the radial tunnel. This is the brachioradialis, moved anteriorly. Radial recurrent artery is seen here. Posterior interosseous nerve is seen here. Supinator muscle, that is called as arcade of Froude. This is the supinator. Radius. So the radial tunnel is an osteofibrous space in the proximal forearm through which the posterior interosseous nerve, that is pin, and radially recurrent vessels pass. So boundaries: superior lateral epicondyle of the humerus, inferior supinator muscle, arcade of Froude, medial radial head and neck, lateral brachioradialis muscle is there. Contents include posterior interosseous nerve pin, that is a deep branch of the radial nerve, radial recurrent vessels. Okay. Definition: compression of the radial nerve in the radial tunnel. Causes include repetitive pronation, supination, gripping, sports, manual work. Risk factors include overuse, vibration tools, repetitive work, poor ergonomics. Symptoms include deep aching forearm pain, tenderness, weakness. Radial tunnel versus tennis elbow. Please go through my tennis elbow video such that you can understand in detail. Compare pain location examination findings. Clinical examination, inspection, palpation, strength, and sensory testing. So here it is a compression test. Pressure over the radial tunnel may reproduce symptoms. So apply firm pressure 3 to 5 centimeters distal to the radial epicondyle, and you can see the radial tunnel area. So this is the lateral epicondyle and radial tunnel area is shown here. To reproduce pain over the radial tunnel due to compression of the posterior interosseous nerve. Patient position: patient is seated, shoulder adducted in position, elbow extended, forearm in neutral position, thumb facing upward. So you can see this. Test taking palpate 3 to 5 centimeters distal to the lateral epicondyle over the radial tunnel. Apply firm deep pressure into the tunnel for 30 to 60 seconds. Observe the patient's response. Positive tests include repression of pain or tenderness in the proximal lateral forearm, or weakness in finger or wrist extension. So this is the tenderness area. Middle finger test, registered middle finger extension, that is Maudsley test. Apply resistance on the dorsal nail aspect of the middle finger. To detect dysfunction or pain of the posterior interosseous nerve, deep branch of the radial nerve in the radial nerve. Patient is seated, shoulder adducted, elbow extended, forearm in neutral position, wrist in slight extension. Because the patient position is important while we do a test. Test technique: ask the patient to extend the middle finger against the resistance applied by the examiner. The examiner places the resistance on the dorsal aspect nail of the middle phalanx. Maintain steady pressure for 3 to 5 seconds. Pause to test repression of pain in the proximal lateral forearm radial tunnel region. Weakness or inability to fully extend the middle finger. Resisted supination test, pain during resisted forearm supination. You can see. The purpose is to reduce pain in the radial tunnel by stressing the supinator muscle and the posterior interosseous nerve, D branch of the radial nerve. Patient position, patient is seated, shoulder erected, elbow flexed at 90 degrees, forearm in neutral position, thumb up. Positive tests include pain in the proximal lateral forearm or the radial tunnel. Pain may radiate down in the forearm, may be accompanied by weakness in extension of fingers or wrist. Test technique includes examiner stabilizes the elbow, patient attempts to supinate the forearm against resistance. Examiner provides firm resistance against supination movement. Hold for 3 to 5 seconds and observe the patient's response. So muscles involved include primary muscle facility supinator, nerve gland posterior, interosseous nerve, D branch of radial nerve. Investigations include clinical assessment, imaging, or nerve studies when indicated. Management includes activity modification, rehabilitation, medication when appropriate. Role of acupuncture may be used for selected patients as a part of comprehensive care. Radial nerve gliding, gently, neurodynamic exercises. So, purpose to improve mobility of the radial nerve, D branch, posterior interosseous nerve, reduce nerve entrapment symptoms, and relieve pain in the forearm and the hand. Perform slowly and gently. Do not force or stretch to the point of pain. Mild tension or pulling sensation is okay. Perform 5 to 10 repetitions 2 to 3 times per day. Start position, sit or stand tall, shoulder down and relax, arm at your side, elbow straight, forearm in neutral position, thumb or facing forward. Shoulder abduction, slowly move your arm out of the side, abduct up to about 90 degrees at shoulder level, keep elbow straight. Okay. External rotation, rotate your arm outward, externally rotate so that your palm faces upwards. This is the palm facing upwards. Wrist extension, bend your wrist backwards, extensions gently so that the fingers point towards the floor. Finger extension, straighten your fingers and thumb, gently extend all the fingers. Head tilt away. Slowly tilt your head to the opposite side away from the raised forearm. Hold for 2 to 3 seconds and return to stop. The benefits are that by using this radial nerve gliding exercise, it improves the radial nerve mobility in the radial tunnel, reduces pain, tingling, and forearm tightness, enhances nerve gliding and function, helps in recovery from radial tunnel syndrome and repetitive strain injuries. The key takeaway is early diagnosis helps guide appropriate treatment. Thank you. That's all for today.